2.2 Examples of target molecules for drugs. Drug target description. Examples: receptors, channel linked receptors. Ligand binding controls a linked ion channel known as ligand gated, in contrast to voltage gated channels that respond to changes in membrane potential. Examples: nicotinic acetylcholine receptor, GABA receptor, sulfonyl urea receptor. G protein coupled receptors, GPCR, GPCRS, GPCRs. Ligand binding affects one of a family of G proteins that mediate signal transduction either by activating intracellular enzymes such as adenylate or guanylate cyclase, producing cyclic AMP or GMP respectively, or by controlling ion channels. Examples: muscarinic acetylcholine receptor, beta adrenoreceptors, dopamine receptors. 5. Hydroxytryptamine or 5-HT serotonin receptors, opioid receptors. Kinase linked receptors. Ligand binding activates an intracellular protein kinase that triggers a cascade of phosphorylation reactions. Examples: insulin receptor, cytokine receptors. Transcription factor receptors. Intracellular and also known as nuclear receptors, ligand binding promotes or inhibits gene transcription and hence synthesis of new proteins. Examples: steroid receptors, thyroid hormone receptors, vitamin D receptors, retinoid receptors, PPAR gamma, and alpha receptors. Other targets: voltage gated ion channels mediate electrical signaling in excitable tissues, muscle, and nervous system. Examples: sodium ion channels, calcium ion channels. Enzymes catalyze biochemical reactions. Drugs interfere with binding of substrate the activate to the active site or of cofactors. Examples: cyclooxygenase, ACE, xanthine oxidase. Transporter proteins carry ions or molecules across cell membranes. 5-HT reuptake transporter, sodium ion or potassium ion ATPase. Cytokines and other signaling molecules, small proteins that are important in cell signaling, autocrine, paracrine, and endocrine, especially affecting the immune response. Examples: tumor necrosis factors, interleukins. Cell surface antigens block the recognition of cell surface molecules that modulate cellular responses. Examples: cluster of differentiation molecules. Example: CD20, CD80. ACE is angiotensin converting enzyme. AMP is adenosine monophosphate. ATPase is adenosine triphosphatase. GABA is gamma aminobutyric acid. GMP guanosine monophosphate. PPAR peroxisome proliferator activator receptor. Figure 2.2 Dose response curve. The green curve represents the beneficial effect of the drug. The maximum response on the curve is the Emax, and the dose or concentration producing half this value is Emax divided by 2 is the ED50 or EC50. The red curve illustrates the dose response relationship for the most important adverse effect of this drug. This occurs at much higher doses. The ratio between the ED50 for the adverse effect and that for the beneficial effect is the therapeutic index, which indicates how much margin there is for prescribers when choosing a dose that will provide beneficial effects without also causing this adverse effect. Adverse effects that occur at doses above therapeutic range are normally called toxic effects, while those occurring within the therapeutic range are side effects, and those below it are hypersusceptibility effects. Drug dose in milligram. Response percentage of maximum 0 to 100 and 0.001 to 1000. Hypersusceptibility, side effects, toxic effects. 100 is Emax, Beneficial effect. ET50 is 0.1 milligram. Adverse effect. ET50 is 100 milligram. This is therapeutic index. 100 divided by 0.1 is equal 1000. 0.1 ET50, ET50 100.